We have next question, which reads, do cord around the baby's neck during the 39th week will not allow the baby to engage its head into the pelvic region? Okay, a lot of technical terms here. Okay, so I'm going to break down that medical jargon into simple terms. Okay, let's say what it means in English and in Tamil. Okay, most of you, I presume, from Chennai, so what they have asked is baby, okay, cord around the neck. So cord in it means toppal kodi. So cord around the neck means at the time of delivery, probably like 9 months or 10 months, when you're almost about to deliver, we do a last scan to check the weight of the baby and fluid level. We also say sometimes that there could be cord loops around the baby's neck. Okay, there's another, the second part of the question is, will that not allow my baby to engage his head? Yes. Okay, so many a times, there are plenty of factors which involves having a baby for normal delivery, honestly speaking. The baby's head size, the size of the baby's head, the size of the hip bone, and what is the baby's head size and the hip bone good enough for the entire baby to go down? And if there's something obstructing that path, so something obstructed by mean that the cord. So I usually tell my patients when they ask me, Doctor, cord irka, karutha pakathla cord irka, toppal kodi irka na? That's why I say one thing. The umbilical cord is around 40 centimeter long, and it's like swirling in and around the baby, and the baby is snugly fitting into the tummy, and a cord which is 40 centimeter long has to be somewhere closer to the baby. It has no other space, so it's going to be there. So when we say that cord around the neck is significant is when we are trying to deliver the patient normally, and the baby's head is not at all descending in spite of the patient having good labor pains. She's not progressing well, the head is not coming down. That means there are loops of cord around the neck which is not allowing the baby to come down. Yes, during that point of time, or if the heartbeat is dipping and the cord is getting compressed, the baby is trying to come down, but the cord is there and it's getting compressed between the hip bone and the baby's head, and the baby's heart is dipping, obviously the doctors or gynecologists, we will not wait for the heartbeat to dip. So we will not allow those babies to have a normal delivery. We will definitely we will take them up for cesarean. Having said that, not that all babies who have had cord around the neck have been delivered only by cesarean. No, that's not true either. Why I'm saying that is, sometimes when babies have cord around the neck, probably lose one loop or two loops, and the baby probably, they are like average size baby, like 2.5 kilos or 3 kilos, and the mother's hip bone is quite wide and the cord is not very tight around the baby, those babies' head will descend, and we have delivered such babies normally too. So it can happen both ways, but generally when we see cord around the neck, we are a little skeptical, and we tell the mothers that we will monitor you, we will monitor the heartbeat, we will see how the pregnancy is progressing, we will see how the pains are upping and how the head is descending, and depending on that we will take a call. So it can happen both ways, and not necessarily that every mother for a baby who's had a cord around the neck in ultrasound will go for a cesarean section. They could also have a normal delivery if all the other factors are conducive for a normal delivery.